Everyone, I am going to discuss about the preventive strategies for COVID-19 among children. As COVID-19 is the latest disease which disturbed our life pattern, and we all suffer from this disease in many aspects. So, before going to start the topic, I just want to welcome you all for liking and subscribing this channel. It gives me an encouragement to make more presentation for you all. So, the preventive strategies for COVID-19 among children. Introduction. Coronavirus disease 2019 COVID-19 is a contagious disease caused by severe acute respiratory syndrome coronavirus 2, or it is also called SARS-CoV-2. The first known case was identified in Wuhan, China in December 2019. The disease has since spread worldwide, leading to an ongoing pandemic. So, definition: any of a group of RNA virus that cause a variety of respiratory, gastrointestinal, and neurological disease in humans and other animals. So, risk factor: the patient is asthma or chronic lung disease, diabetes, genetic, neurological, or metabolic conditions, sickle cell disease, heart disease since birth, and immunosuppressions and obesity. Causes: close contact with about 6 feet or 2 meter less than, so it may be causes the coronavirus, and respiratory droplets released when someone with the virus cough, sneeze, breathe, or talk. Spread if a person touches a surface or object with the virus on it and then touches his or her mouth, nose, or eyes. Sign and symptoms: cold, mild cough, fever, body pain. COVID-19 symptoms such as pain in the abdomen, loose motions, and vomiting also. Clinical symptoms are that affecting the children and adolescents is fever, headache, body pain, tiredness, cough, breathlessness, poor feeding, loss of taste or smell in children over 8 years old, or rashes, red or pink eyes, swollen or red lips, tongues, hand or feet. So the complication of this disease is pneumonia or troubled breathing, organ failure in several organs, heart problems, a severe lung condition that cause a low amount of oxygen to go through blood streams to organ, and acute respiratory distress syndrome, blood clots, acute kidney injury, and additional viral and bacterial infection also can occur during this time of COVID-19. Ways to protect children from getting and spreading COVID-19. So, all the parents have to instruct the child that they have to wash their hand for at least 20 seconds. If soap and water are not readily available, make sure that the child uses hand sanitizer that contain at least 60% of alcohol. Teach children to cover all the surfaces of their hands with hand sanitizer and rub their hand together until they feel dry. If child is under 6 years of age, supervise them when they are using hand sanitizer. Now the parents, guardians, or caretaker play a vital role in teaching the child to wash their hand. Child must wash hands immediately after returning home if he is going anywhere in the rooms, because in the COVID-19 time there may be quarantine or they may be home isolation, as well as they after going from bathroom also or before eating food. So young children how to get the soap between fingers and ways to the end of the fingers, including their thumb and back of hands, about 20 seconds, so they spend the time they need to get their hands clean. Make hand washing a family activity. Be a good role model. If parents wash hands as recommended, they are more likely to do the same. Practice cough and sneeze etiquette by covering nose, mouth with a tissue when sneezing or coughing, throwing the tissue in the closest garbage can, and washing hand after throw it away. Avoid close contact. Keep the child at least 6 feet away from the others who don't with them, and those who are sick, such as cough and sneezing. Limit in-person playtime and connect virtually with other children. An important guiding principles to remember: as the child interacts with more people and the longer that interaction, higher the risk of COVID-19 spread. Maintain social connections while social distancing. Help them have supervised phone calls or video chats with their friends, and limit the child interaction with people at higher risk of severe illness from COVID-19. To protect those who are at increased risk for severe illness from COVID-19, postpone visits or trip to see grandparents, older family members, and family members who are at risk for severe illness from COVID-19 and during the time of COVID-19. So they children can meet or interact other family members through virtual connection. Then considered connecting virtually or by writing the letters. Wear mask if not fully vaccinated, and age 2 or older should be have to wear mask in the public places if the COVID-19 is removed, or it can be minimize the cases of COVID-19. In the areas with higher number of COVID-19 cases, consider wearing a mask in crowded outdoor settings for activities with close contact with others who are not fully vaccinated. If fully vaccinated and have a condition or taking medicine that taken immune system need to keep taking step to protect, wearing a mask. Talk healthcare provider about step to manage the health and risk. CDC recognizes that wearing mask may not be possible in every situation. For some people, means some children, they can throw it easily. Correct and consistent use of mask may be challenging for some children, such as children with the certain disabilities or including cognitive, intellectual, developmental, and sensory behavior disorder. So at that time, the parents have to observe their children. Clean and disinfectant. Cleaning with the household cleaners that contain soap or detergent reduce the amount of germs on surfaces and decrease the risk of infection from surfaces. In most situations, cleaning alone remove most virus particles on surfaces. Clean high-touch surfaces and objects regularly, for example, daily or after each use and after you have visits in your home. Focus on high-touch surfaces and objects, doorknobs, tables, handles, light switches, phones, remote controls, and countertops. Clean other surfaces in home when they are visibly dirty or as needed. Clean them more frequently. People in household are more likely to get very sick from COVID-19. Disinfectant if certain condition apply. Clean surfaces using a product suitable for each surface following instruction on the product label. When someone is sick, if someone in home is sick or someone who has COVID-19 has been in home in the last 24 hours, clean and disinfectant home. Disinfecting removes germs and reduce their spread. Wash items including washable plus toys as needed. Wash dirty laundry from a sick person together with other people's items. Consider challenging travel plans because travel increases child's chances of coming in contact with others who may have COVID-19 and child spreading the virus that causes COVID-19 to others if they are infected. Staying home is the best way to protect child. Any place where travelers interact with other people, for example, airport, bus station, train station, gas station, restaurant, and rest stops are places travelers can expose to the virus in the air or surfaces. It can also be hard to stay at 6 feet apart from other person during travel. So we have to limit the travel. The guidelines for preventive measures and suggested changes in child's daily routine that can be considered by parent. Give them lukewarm water to drink according to their capacity. Gargle sound to be performed with warm water added with a pinch of salt and turmeric for children above 5 years or when the child is able to perform. The physical activities is important to keep their immunity strong during the pandemic. According to IU's guideline, a child needs to be physically and mentally alert to fight the disease, and for that yoga and meditation and other exercises are recommended. Diet. A child should eat easily digestible, fresh and warm and balanced diet in the suitable amount according to the appetite or digestive power. Sleep. Child should encouraged to go to sleep early at night. Sleeping hours should be according to age. Less than 1 year, 12 to 16 hours, 1 to 2 years, 11 to 40 hours, and 3 to 5 years, 10 to 13 hours, and 6 to 12 years, 9 to 12 hours, and teenager 8 to 10 hours. If a mother and her children are COVID-19 positive, let children stay with their mother unless their mother is too sick to care them for or is hospitalized. For infant children's mothers should be continue breastfeeding as much as possible and feasible. If a mother is COVID-19 positive but her children and child are negative, if no other child care options are available and the mother is not too sick for hospitalized, she can take care of children. Take the best possible sanitization measures, wear double mask properly, maintain physical distance. Parents can continue to take care of the child. However, while caring for the child, parents should use a proper mask, use personal protective equipment, including gloves for their own protection. Avoid leaving children with confirmed or suspected COVID-19 with their grandparents. Elderly people are very high risk of serious disease from COVID-19. So, unless a child status is corona negative, they should not be felt with or to be in contact with their grandparents or any family members they are living with. Which children are at risk of getting severe illness from COVID-19? Heart and kidney, liver disease, malignancy, obesity, chronic lung disease, sickle cell disease, and those children having the immunosuppressant also be increased risk for severe illness from COVID-19. Do all the children who develop severe COVID-19 needs to go to the ICU All children with severe disease will need hospital care, but not necessary ICU care. Severe cases that develop acute respiratory distress and in certain other complications will require management in the ICU. What should I do if my child has symptoms of COVID 19? Seek medical attention. If advised by the doctor, then isolate and stay at home. When I should get my child tested for COVID 19? Family members that child has been in contact with test positive or COVID 19, child has symptoms of COVID 19, or child has fever that has continued beyond 3 days. Now there is some treatments, that is remdesivir is only the drugs approved by the Food and Drug Administration FDA. It is approved for treatment of COVID-19 in hospitalized adult and the pediatric patient aged more than 12 years and weighing more than 40 kg, and pediatric patients weighing 3.5 kg to less than 40 kg or aged less than 12 years and weighing less or equal to 3.5 kg. Remdesivir is recommended for hospitalized children aged more than 12 years with COVID-19 who have risk factor for severe disease. Remdesivir can considered for other hospitalized children of all age with COVID-19. Next one is dexamethasone is recommended for the treatment of hospitalized adult with COVID-19 who required mechanical ventilator or supplement oxygen through a high flow device. Use of dexamethasone for the treatment of severe COVID-19 in children who are profoundly immunocompromised has not been evaluated, may be harmful, and therefore may be considered only on case by case basis. The dexamethasone A dosing regimen for pediatric patient is dexamethasone 0.15 mg per kg per dose, maximum dose 6 mg once daily for up to 10 days. Convalescent plasma, the safety and efficiency of convalescent plasma have not been evaluated in pediatric patients with COVID-19. The panel recommends against the use of this drug for the pediatric patient with COVID-19 who are mechanically ventilated. In consultation with the pediatric infectious disease specialist, convalescent plasma may be considered on the case-by-case basis for children who meet EUA criteria for its use. It's all about the bibliography from where I take this all contents, and thank you so much for listening.